Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Sarah Carlson, Emily Dobbins, Ashley Lee, Emma Primeaux, and Victoria Sherman are here joining us today to discuss their evidence-based practice project. Before they get started, though, with their discussions, I want to let all of our listeners know that I have shared a copy of this group's evidence-based practice poster that accompanies this podcast episode. You can find that link directly in the show notes for whatever podcast app you're listening to right now. So without further delay, let's turn the show over to Ashley to get us started.
Hello, listeners. My name is Ashley Lee, and on behalf of my other group members, I'd like to welcome you to our podcast, discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is The Effects of Music Therapy for Dementia Patients, and the members of our work group include Sarah Carlson, Emily Dobbins, Emma Primeaux, Victoria Sherman, and myself, Ashley Lee. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana.
Thank you for introducing your team and for presenting your project topic, Ashley. Music therapy has become an increasingly discussed approach in the care of individuals with dementia, especially as providers search for meaningful, non-pharmacologic ways to support quality of life. To help our listeners understand why your group chose to explore this area, Ashley, can you begin by sharing the problem your team set out to address and why is a topic like this important for us to examine as nurses?
So our group chose the topic of dementia because it poses a serious concern for patients who are unfortunate enough to develop it, and also for the caregivers who have to witness it. It's a cognitive disorder, and it tends to show up in later adulthood, and currently it doesn't have a cure. So characteristics of dementia would include memory loss, disorientation, motor skill problems like tremors or walking difficulties, and possibly the saddest one to watch is their personality changes. Personality changes could include aggression and irritability. And it undergoes different stages, and it gradually will gain more severe conditions that sadly will eventually lead to death. The time in between this gradual decline can be brutal for the patient and also for the caregiver if not palliated. There are some known medications like cholinesterase inhibitors and NMDA antagonists that can help to slow the progression, also as well as non-medicated therapies. But because there's no cure for dementia, there are many patients with their families who wish to try every measure that's possible so that they can improve the patient's quality of life, may that be medications or alternative therapies. So alternative therapy that we decided to focus on as a group is music therapy. It's a known intervention and is incorporated for memory and cognition retention, but the mechanism in which it still works is still being studied. However, it is showing that exercising music therapy for dementia patients can cause higher cognitive functioning and lower levels of depression and anxiety. And as future nurses, we do care about our future patients' mental well-being and their quality of life as they age into their later adult life.
Thank you for outlining those important considerations, Ashley. Your explanation highlights the complex and progressive nature of dementia, and it also underscores why both patients and caregivers benefit from thoughtful, supportive approaches to care. As you noted, there is growing interest in music therapy as a potential way to enhance quality of life, making this a meaningful area for evidence-based exploration. To guide your group's investigation, you developed an evidence-based practice question. So Emma, Can you share that EBP question that your team created and how it shaped your research process?
Now that we have established the significance of the evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We have created our EBP question using a PIO format, which stands for Population, Intervention, and Outcome. Our question is, in older adults with dementia, how does the use of music-based interventions affect levels of anxiety and depression? This question is important because anxiety and depression are common behavioral and emotional symptoms among patients with dementia and can greatly affect their quality of life. By exploring music-based interventions, we aim to identify non-pharmacological approaches that can support emotional well-being, enhance communication, and improve overall quality of care for this vulnerable population. Our goal is to use evidence-based care to guide nursing practice and promote holistic, person-centered care for patients living with dementia.
Thanks for sharing your group's PIO question with our listeners, Emma. This question served to focus your group's investigations into the literature. So can you tell us more about how you use that PIO question to help you find published research studies about your selected topic?
We used our group's PIO question to create keywords to search for the following university library databases: CINAHL, Academic Search Complete, Health Source Nursing Academic Edition, Medline, and the Cochrane Library. Some of the keywords that we used for our searches included dementia, music intervention, music therapy, quality of life, social behavior, cognition, evaluation, and quantitative research. We set specific search limiters on our searches, including peer-reviewed articles, full text availability, publication within the last 5 years, and nursing journal subsets. These limiters help ensure that our sources were both credible and relevant to our topic. Something that went really well in our literature search was that the CINAHL produced several high-quality nursing-focused articles that directly addressed our evidence-based question. We also found that using quotation marks around the key phrases like music therapy improved for the accuracy of our search results.
Thank you for walking us through your search process, Emma. It sounds like your team used a thoughtful strategy, especially with the use of limiters and quotation marks, to refine results and filter out irrelevant studies. A well-structured search really does set the foundation for strong evidence-based work. Now that the literature had been gathered and reviewed, let's take a closer look at what the research actually showed to your group members. Sarah, can you walk us through the key findings that your group identified?
After conducting our literature search using the methods previously described, we sorted through the study articles to find high-quality studies that specifically addressed our EBP question. Each group member was responsible for critically appraising one study article, and we synthesized the studies into a guiding group synthesis table to get a bigger picture of the state of the science surrounding our topic. Our first article showed that there was overall better quality of life and caregiver communication with the dementia patient. In a study conducted in Spain about music programs implemented into the daily lives of patients with dementia, where they were allowed to pick music and listen to it throughout the day, 84.7% of the caregivers stated better communication with the patient, 76.9% stated it helped with their relaxation, 69.3% stated that was conducted in 5 rural nursing homes. They found that there was a statistically significant decline in aggressive behaviors of daily listening to musical playlists that the dementia patient helped create, so it was individualized to the patient. This reduction in aggressive behaviors included behaviors such as verbal agitation, physically non-aggressive behavior, and hiding and hoarding and sadness. Our third article showed the improvement of cognitive skills and depression symptoms with the implementation of music therapy in patients with dementia. The music therapy was the action of listening to music playlists tailored to the patient 4 times a week for 3 weeks, and at the end of the study, the patients included in the experimental group had increased autobiographical memory, enhanced communication skills and learning abilities, and an overall improvement of their cognitive function. Our fourth article showed that the dementia patients In the experimental group, including the active participating in musical activities such as playing and learning an instrument, as well as listening to music on a playlist they created, had a significant decrease in their depressive symptoms and on the depression evaluation test used in the study. Lastly, a study performed with the implementation of daily music listening in dementia patients living at home with their family caregivers, their overall behaviors improved, including an increase in apathy, decrease in irritability, a decrease in agitation in the person living with dementia. The caregivers of those patients also explained a decreased stress level for themselves while taking care of the dementia patient, as they were happier and less sad in those who had the musical therapy.
Thank you for sharing your findings, Sarah. Despite a few moments of sound distortion and technical difficulties in the recording, the insights you presented came through very clearly. The studies you reviewed highlighted meaningful benefits of musical therapy, not only for individuals with dementia who experience reduced apathy and irritability, but also for caregivers who reported improved communication and decreased stress levels. The evidence also suggests that allowing patients to select their own music may enhance these positive outcomes even further. With these results in mind, it's important to consider how nurses can apply this information in everyday patient care. With that in mind, Victoria, can you share the nursing practice implications that your group's members identified?
Based on the information our group reviewed, we noted some synthesized implications for nursing practice. Our implications all deal with using music therapy to improve dementia patients' mood and/or cognition. The first implication for nursing practice is facilities like nursing homes should incorporate structured time for music-related activities to determine if it has a positive outcome on dementia patients and their mood, or if it results in increased cognition. The second implication includes bedside nurses and home health nurses can incorporate music therapy in their care plans as a non-pharmacological intervention to improve dementia patients' mood and possibly lower their depression levels. The third implication is bedside nurses and home health nurses in hospitals or nursing homes can incorporate personalized music therapies to reduce the agitation of a dementia patient when they may be agitated that they cannot remember something.
Thanks so much for outlining those practice considerations, Victoria. Your points highlight how music therapy can be integrated across multiple care settings, from structured activity programs and long-term care facilities to individualized interventions at the bedside or in home health. These approaches offer simple, non-pharmacologic ways to support mood, reduce agitation, and enhance overall well-being for individuals living with dementia. Building on that, your group also identified areas where further research is needed to strengthen the base of scientific evidence. So, Victoria, can you share the research implications that your team identified?
There are still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research related to how music can improve the quality of dementia patients' lives. The first implication for research includes future researchers could make the population size larger when conducting another study and should include different stages of dementia. This will expand the information and further prove how music therapy improves the lives of patients in different stages of dementia. The second implication is that researchers suggest patients who are more high risk instead of just focusing on low risk patients and the results. This will allow for more versatility in the experiment and the results. The third implication is future experiments should be conducted over a longer period to determine if long-term music therapy is more beneficial. This will evaluate if depression levels and cognition decline or improve as music therapy continues.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the reviewed studies that your group looked at, including considerations for any weaknesses, limitations, gaps in the present literature, what was your group's overall literature-based answer to that original PO question?
After all of the research studies that our group reviewed, we were able to determine an evidence-based answer to our EBP question. We deciphered that music therapy has been shown to improve the quality of life in adults with dementia. Music therapy can reduce depression, allowing those who suffer from dementia some comfort and better cognition, thereby enhancing their quality of life. The studies we reviewed supported the short-term benefits, helping patients feel calmer and more emotionally balanced. For example, we observed that personalized music created by dementia patients had a more positive outcome than songs they were not familiar with. These songs improved memory recall and decreased their agitation. However, these studies still need to be tested for their long-term effects. We still need to see if these improvements will stop once the music therapy does or fade with continual use of music therapy. What I have learned by exploring this topic is how important evidence-based practice is in nursing. While caring for patients, one's intuition is not enough to give them the proper care they deserve, but rather to do through thorough research with up-to-date studies of the effectiveness and weaknesses of certain theories and interventions. With EBP, nurses can research questions they may have about a certain type of patient care to see if they are doing all they can do, or if there is a more efficient way that someone has recently found out about. EBP has allowed nurses to truly make a difference in patient care with the research they have put together from their sample size, study design, and applying those findings into a clinical setting to test the study. As a future registered nurse, I can benefit from what I have learned from this project. I will be able to advocate for music therapy as a short-term solution for my patients with cognitive decline or agitation issues with the information my group has gathered. I will also be more confident in seeking out research and interpreting that data to implement into my practice. This project has shown that nursing is a fast field that takes many ideas into consideration and then forms those ideas into evidence that other nurses can use while providing care, such as what we have found on how music therapy is a good complementary therapy that can improve the quality of life in dementia patients. And this is just one study that can be found. There are countless others to be discovered for nurses to incorporate to truly improve their patients' quality of life.
Thank you for summarizing your group's conclusions so clearly, Emily. The evidence you reviewed highlights meaningful benefits of musical therapy for adults living with dementia, including improvements in mood, reductions in depression rates, and even gains in cognitive engagement. Your point about personalized music producing stronger outcomes than unfamiliar selections is especially important, as it reinforces the value of tailoring care to each individual. At the same time, you identified an important gap that persists. We still don't fully understand the long-term impacts of these interventions or whether the benefits persist once the music stops. This is exactly why staying up to date with emerging research is essential for nurses. By continuing to read, question, and apply the latest evidence, you strengthen your ability to advocate for meaningful, patient-centered interventions like music therapy. Thank you to all our listeners for joining us today. Exploring non-pharmacological therapies like this invites us to think creatively about how we support individuals with dementia and their caregivers. We hope you'll continue learning alongside us in future episodes of Nursing Research Tips.